All right. Well, good morning, everyone. Welcome to our latest edition of Three Plastic Surgeons and a Microphone. As you'll notice, though, in our box today, we actually have four plastic surgeons because we are fortunate to be joined by a special guest we'll introduce here in just a second. But just to want to introduce everybody, I'm Sam Jejurikar in Dallas, Texas. Also joined by my compatriots, Dr. Sal Pacella, whose Instagram handle is at San Diego Plastic Surgeon, and Dr. Sam Rhee in Paramus, New Jersey, at Bergen Cosmetic. And we are doing I think this is our 16th or 17th episode of this. So just a little bit of informational stuff before we get going. This show is not a substitute for professional medical advice, diagnosis, or treatment. And this show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion, and always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of something in this show. So, regardless of what someone's background is, I think we all recognize the need for mentors, whether you're a surgeon, whether you are an accountant, whether you are a basketball player. There are people that are instrumental in shaping your career. When we're medical students, we look to what doctors we try to emulate to decide what profession we want to do. And even when you become a plastic surgeon, you see people who you want to be like and who guide you. And so that's why we are so fortunate to be joined by Dr. Rod Rohrich. I'll say on a personal level, Dr. Rohrich actually founded a group called Dallas Plastic Surgery Institute, which is one of the leading groups in the country. I'm happy to be one of the members of that group, and he is one of the founding members of that group. But beyond that, he is so much more. He is, just for the people that are watching this, in 2014, when a study was actually done of the most influential plastic surgeons in the current era, he was one of the 10 most influential plastic surgeons in the world. He's a past president of the American Society of Plastic Surgeons. He's a past president and one of the founding members of the Rhinoplasty Society. He is the editor-in-chief of the Journal of Plastic and Reconstructive Surgery, which is the leading journal in plastic surgery. He's the chair and founder of the Dallas Rhinoplasty meeting, the Dallas Cosmetic meeting, which are huge international meetings in plastic surgery that are attended by thousands of plastic surgeons annually from across the world. He's received the Plastic Surgery Foundation Distinguished Award, I think, 3 times, and has also won the American Society of Plastic Surgeons Special Achievement Award. I was looking at his CV yesterday to try to do an appropriate introduction. I think it's 232 pages. I kind of got overwhelmed, but anyways, we're really fortunate to have you, Dr. Rohrich. Thank you so much for joining us today.
Well, thanks, Sam. I wish my late mother could have heard that, because all she said to me ever after medical school, she said, "I just want you to get a job." And that's what they did.
But all modesty aside, you have accomplished in plastic surgery more than any other plastic surgeon I've ever met. When you sort of, at this point in your career, when you've done everything, I still know you to be one of the busiest and most driven surgeons, if not the most, that I've ever seen. What keeps you motivated?
I love what I do. I think it's passion. I think giving back, and now it's teaching the next generation. Well, it's always been that, but I think passion, giving back, and loving what you do. If you don't love what you do, I mean, every day I do elevator thoughts recently in the last 6 months and put them on Instagram, because I think it's really, you have to be driven to do it. And the other thing that all of you know is that plastic surgery is not a job. We're very lucky because it's just a way of life. And every day I go to job, I say, this is so amazing that, I was able to do what I love to do, and it's not really work. I think all those things help all of us.
Yeah. Well, if you were to, I know how important education is for you, and I see you with residents and fellows. As you are sort of shaping the next generation, what are some important bits of advice that you give to young plastic surgeons about what to look for in a career and how to build their practice?
I think the biggest thing is 2 4-letter words that most people don't want to do, and that's hard work. You have to work hard, be focused, be passionate, and take great care of patients. I mean, I know that sounds very simple, but man, it's hard to do because there are a lot of barriers to that. Just life in general, the business of plastic surgery. But if you focus on doing that every day, being the best you can be. And I always, in the morning, I would say, what are the 3 things I'm going to do today? And after that, it's gravy. So if I accomplish my top 3 goals, hopefully before noon, I'm good. So I think that, and giving back. I mean, the amazing thing it took me a long time to learn is that the more you give back, the more you get. And so I love that.
Um, guys, feel free to chime in here at any point as well. I feel like I'm hogging the conversation, but
so Rod, I just when I was a medical student and I was interviewing for residencies, I first met you, I think, back in 97 or 98 when I was interviewing, and I went down to UT Southwestern, and you gave a talk on how to be successful in plastic surgery to the applicants. And there was a beautiful picture you showed of at the very end of the talk, you showed this picture of a very wide cleft lip in an infant, probably, at least a couple centimeters. It's a huge one. And then you clicked the slide and you said, if you follow along this path, you can do things that look like this. And you click the slide and the final result, and literally you could not tell that this child had a cleft lip. And I looked at that and I said, this is just absolutely unbelievable and amazing. And, he's got it dialed in. So really impressive stuff.
Well, so when I was a medical student at Baylor, in the late 70s, early 80s, I was going to be a cardiac surgeon because I was on Dr. DeBakey's service. So one day, Dr. DeBakey said, and I was one of 4 medicals. They finished early, which was very rare. He said, go watch this plastic surgeon. He helps us out. It happened to be Mel Spira, who just passed away this week. So I walk in his room, he's doing a cleft lip. And he, and all of you who know Dr. Spira, I said, come, he was talking fast. It comes, just scrub in. So I scrubbed in and watched him do it. And I said, you know what? After that, I said, I'm out of here. I want to do what you do. I want to reform and remake. I mean, to me, plastic surgery was, it was an adjective, not a noun. So, I mean, it's been transformational. So that is why I went into plastic surgery.
Kind of jumping on Sal's story of an interview. I interviewed also as a medical student, but the interview that's that sticks out most in my mind is the interview for when I tried to be when I became a partner of Dallas Plastic Surgery Institute. I came down. I was finishing up my first job, and Dr. Rohrich and some of the other partners had required me to sort of bring 25 of my cases for them to look at to see whether I was worthy of joining this group. So nobody looked at him except Dr. Rohrich. He flipped through about 25 cases in about less than 25 seconds. Said B plus. And he said B plus.
Which is very good.
Which I learned at that time was probably the highest grade I've heard him give out. I don't think I've ever heard him give out higher than a B plus. And I just thought, what am I getting myself into here?
Rod, I have a question for you. Who would you say are your most cherished mentors in plastic surgery?
I would say it would be Dr. Dingman, Dr. May, Dr. Mathis, Dr. Spira, and then also Dr. Bill Grab. He died when I was like the 3rd year, but those are the people. You pick mentors when you want to emulate what they do and what they've done and how they live. And I can tell you, when I went to Michigan, I mean, I don't know, none of you got to meet Dr. I was very lucky in one way, because I had 3 chiefs. As you know, I had Dr. Grab, then I had Dr. Dingman, who came back. So the great thing is we had to all scrub with Dr. Dingman as senior residents because, we wanted to make sure everything was good. Then we had Dr. Mathis too. So Dr. Dingman was awesome. I remember one night I was doing a free flap at Children's. Remember, the Children's is the only place we used to operate. So all of a sudden I heard somebody breathing behind me. It was like 9 at night. We were doing a leg to stake the leg, latissimus. There was Dr. Dingman at 8 o'clock at night at the University of Michigan at Children's Hospital. I said, wow. He said to me, can I take a look? I said, absolutely, Dr. Dingman. Yeah. I'll never forget that. As you know, at those times, to have a faculty in the operating room was amazing.
It's funny. I remember being at Michigan. Some of your the people who trained with you said you had ambition even at that age. They like in training. They said you, and I don't know, is this true? I wanted to ask you that as a third-year resident, you created or brought together an international symposium during that year, basically all by yourself, is what they said.
Well, I did do the first international symposium on tissue expansion when I was doing my fellowship at Oxford, in my 5th year, and we brought everybody over, Wildman Radovan and all, the Michigan did a lot of expansion tech science, and Dr. Cherry and everybody, and yeah, it was fun, and it was a riot.
It seems as though now would be an appropriate time to continue the Michigan theme. Sam, you want to do the honors?
Oh, no, we just wanted to honor Dr. Rohrich and the legacy at Michigan. We have a special guest for you today who also may want to join in, and I'm going to go ahead and introduce him. This is, let's put him in first. This is Dr. Paul Sederner. He is the chairman of plastic surgery at University of Michigan.
Yes, I know him well.
Hi, Warren. Good to see you guys.
How are you?
Yeah, it's I think we are talking about Dr. Rohrich's story about why people went into plastic surgery. I'm not even sure I've ever told Paul this story, but when I was a 4th-year medical student at the University of Michigan, I thought I wanted to go into cardiac surgery, much like Dr. Rohrich. I did my rotation. I realized it wasn't really what I wanted to do. My older brother's a plastic surgeon. He encouraged me to look at plastic surgery. And my first day in the plastic surgery rotation, the chief resident was Paul Sederner. And,
oh my God.
And Paul Sederner, I remember was listening to the Bare Naked Ladies in the OR. I think we were doing a breast reduction. He kept having me put in deep dermal stitches and take them out because they were no good. And I think I got one in the whole case. And I love this case. I love this guy. And I went into plastic surgery. So speaking about mentors, I think things are coming full circle. So, the two of you are both leaders in plastic surgery, and you guys have been through a lot. You've faced your share of adversity, your share of challenges. What's different now in plastic surgery training than it was when you guys were training? And, if you were to take a medical student who's thinking about going into plastic surgery, why would you tell them it's a good endeavor for them? Like, why should someone do it?
Go ahead, Rod.
It is so different. I think that it's still the only specialty where you can do it all and be, the consummate physician, from head to toe. In a world where medicine is so specialized, you can still do it all as a generalist. And I think that's very unique. And I love that. And of course, that's the path I took. And right now I'm very focused on what I do, but everybody can start there and stay there as long as you do good work, and so that's what I tell the medical students. But I always tell them, you got to do hard work, you have the passion, and you can do it. But so many times people today want the shortcut, and those are the people that I think plastic surgery is not a shortcut, not if you want to be great. What do you think, Paul?
Yeah, so thanks, Rod. I couldn't agree with you more. I got to tell you, I love plastic surgery. And the reason I love it is I love the fact that we just take some basic foundational principles and we solve an infinite number of problems with those principles. And I love when somebody calls me, they're in the operating room and they are just struggling and they can't solve some problem. And they call me. I've never seen it before. I walk in the room, I see that thing in front of me and I'm like, yeah, we got this. Let's change the music on the radio first because we got okay. Let's everyone just relax now because all those other surgeons that are super uptight, they're gone. And now we're all going to relax and we're going to fix this really hard thing and we're going to help this patient. And I absolutely love that. And, in my clinic, I've got a burn reconstruction. I've got a bad hand. I've got a hole in a foot, a hole in a face. I have someone that's nose is crooked that they want straight. I have all of that in one clinic. There's no specialty you can do that in. And that's what makes it so amazing.
Yeah, I totally agree, Paul. Especially when I was at UT, I had the same thing because I would do hand surgery. I'm a hand surgeon. I did everything. And I miss that, but that's what plastic surgery is the differentiator. So I tell medical students, you want to be the best you can be, then work hard, be focused, and be passionate. Because I think the biggest thing that we lack in our specialty today in some people is the passion. And if you have the passion, you can be fantastic. I don't care how smart you are, because and your background, it doesn't matter where you came from. It's where you're going that's important. I mean, heck, I grew up in North Dakota, didn't speak English, and I ended up going to the University of Michigan, and a few other small places, but none of them were as cherished as the University of Michigan. My English still isn't so good.
So I
sorry. What I was going to say is, in listening to both of you guys and my two colleagues, it's clear that, I think an overlying theme of plastic surgery is that we, as plastic surgeons, and mostly this is in the realm of reconstructive surgery, but also of cosmetic surgery, we are the surgeons, right? We are the people that solve those types of problems. We are the doctors that other doctors call to solve those problems. And I just, I think that's a true honor. Somebody once described to me, and in fact, sometimes patients, I'll do a forehead flap on a patient or a nasolabial fold flap or something. And patients tell me, hey, this is just unbelievable how you can do this. And I say, well, much smarter people than myself have created these techniques. And, I use the saying that I learned at Michigan: standing on the shoulders of giants. You can only see as far as you can because somebody else, you're standing on their shoulders. And I think that's an overlying theme in plastic surgery. It just builds on it,
Yeah. We were very lucky to train at Michigan. I mean, you don't know it till you leave and go someplace else. You really don't. And I didn't know it. Honestly, Mel Spira, I remember when I was a medical student, he said, you're too good to stay. You got to go to Michigan, because then Bill Grab and he were good friends. So I go to Ann Arbor. I never even heard of Ann Arbor before. And I go there and I went, wow. And you meet guys like Dr. Grab and Dr. Dingman and people that you read about, you go, gee, this is like impossible. And, the rest is history, as Paul mentioned.
So I gotta tell you, for me, so I come here and I have people like you and like Jack Gunter and Steve Mathis, all these giants in plastic surgery who came through this place. And then the place that I'm working at has people like, Kevin Chung and Bill Cruzon and Steve Buckman and all these people who've been president of everything. And you go, this is awesome. And then at the same time, you're in this beautiful college town with this massive volume of stuff to do. So you have all the complexity you could ever dream of as a surgeon to solve the problems that no one else wants to touch. And you're like, those are actually the ones I want. Those are my cases. Bring those to me. And you get to do that stuff. And at the same time, you get to do it in a beautiful place that looks like this, even in January.
Yeah.
Every day. I mean, you think it's nice in Dallas in January? You need it like this.
Right.
I mean, I did spend 15 years there. I'm going to take Dallas.
Yeah, you know what? You were doing so good until you mentioned the weather.
Yeah. Unfortunately, you lost all credit. You lost all credibility at that point.
Yeah. It looks like a nice day today, but I can tell you, the thing is, the people, you forgot one person, and that's you, Paul. You have been transformational. I mean, I can tell you, when I go back, I've been back to Michigan so many times recently. I mean, I can tell you, it is like a whole, of course, I was one of the last residents in the old University Hospital. None of you guys, it was a footprint, but it's been transformational to go there. It is unbelievable. And Paul, you are the consummate leader and what really makes plastic surgery just tick today in Michigan. And I'm not just blowing hot air at you, because if it wasn't true, me, I wouldn't say a word about it. But so, kudos to you.
Yeah. I wanted to ask about leadership since we brought it up. I mean, Paul's, he mentioned a lot of big people that he's working with now. And Dr. Rohrich, you've been working with, you established one of the biggest, greatest centers in Dallas with some of the biggest, greatest plastic surgeons there. What is it like being a leader with people who are obviously very passionate, very successful? Plastic surgeons are very independent. and there can obviously be, is there room, like how do you make room for everyone as a leader, and how do you establish yourself as a leader with all these types of people there?
I think the biggest thing is that you have to listen, be respectful, and honor those that come before you, but also that are with you. I mean, imagine I was with people, and Sam knows this, Hamra, Barton, and Bert. They're all great people. Everybody has big egos, but I think, we're all in it because we love plastic surgery, and the common bond has been always we want to teach and do good things for our patients and for the specialty. So I think when you put people in that arena of common things that we all love, then all the other things tend to go away normally, which is a lot of egos. Believe me, we have a lot of egos in Dallas, and so I think it's always been a challenge. But if you give people the recognition that they deserve, I think people are fine. And sometimes, it can be a challenge, but I think recognizing everybody's expertise in what they do and do well, I think we can then do things better together. And I think that's been a big challenge in plastic surgery, as you know, that's prevented us from doing even greater things as a specialty.
The other follow-up I wanted to ask real quick, sorry, is and maybe both Paul and you can comment on training the residents now versus say 10 years or 15 or 20 years ago. When I remember when I was taking my mock orals and I was preparing, we had a bunch of UT Southwestern residents, and I will tell you, I mean, they told some hair-raising stories about their conferences every week, but they were certainly the most articulate, the most knowledgeable, the most impressive in terms of displaying their knowledge in these mock orals than I've seen of any other program. But they certainly said it was a very challenging time for them during that period. And so how is that compared to how things are now?
Well, it was a different time. And, when I was, I actually try and have people be as good as they can be. And, I always tell my, and as part of that PowerPoint, Sal and Sam and Sam, one of my last slides was that you will be the best you can be. And so my job was to make you the best you can be. And that's the same today for fellows and the residents that rotate, is that, and I really learned that at Michigan. Obviously, I took it to another level because, it was, I'm a little softer today, but people, you need to challenge. If you don't challenge people, especially millennials, and I challenge them in a different way today, you have to challenge them to be better. And so even with the fellows and residents today, I always ask them, what are the 3 things we're going to accomplish? And what did you learn in the case? What are the 5 things you've learned? And we put that on Instagram. So I think the reason is, if you don't challenge yourself, many people today, see, I challenge myself every day. But if you don't challenge others that don't have that capability, they're just going to get by. Isn't that amazing? They're all type A's, but many people just want to get by. And to me, getting by is failing. And now, we expressed it a different way in the 90s and how we taught, because today we'd probably be put in jail for things we would do. But, it was never, honestly, 90% of the things you hear about.
What do you mean by that? What do you mean?
Well, all I did was I said, okay, that was not a correct answer, and you didn't read the literature, so you're going to come back next week and become the expert. And they had this little box, but it challenged them to be better. Now, today we say, well, that was very good. That's okay. And I know you didn't get any sleep because you had 8 hours of work, but, maybe tomorrow we can do better, but, and you have to go home now. But the thing is, everybody has a different level of being able to learn. And sometimes I read in last month that said, oh, I'm a visual learner. That was AKA code for I'm not reading, So he became a visual, but also a reader too in a month.
So I think I got to tell you, things are actually they're just really, really different now. And people are very different now. And because they've been raised differently, we need to employ different strategies for them to get the same amount of information. Because if we use the strategies we used in the 90s, most people are going to shut down and you're going to get nothing out of them. Because everyone was raised in a different way. People weren't raised getting spanked. People weren't raised getting sat on the bench on their sports team because they just didn't perform. They were raised at equal play time. I mean, it's just different. It means then that we have to employ different strategies also. And so our job, more than anything, is to figure out the individual needs. And we actually are doing our best to personalize training and personalize education to each individual, because everybody needs a little bit different.
Right.
And in the old era of one size fits all, beat them until morale improves, that doesn't fly anymore. And so we work really, really hard, and we have actually external consultants coming in, helping us understand the dynamics, helping us build new programs, helping us to build these things so that we can actually make everybody, give everyone the opportunity to achieve their potential in whatever area that is.
Yeah,
And
that is very right. And I want to tell you, Paul is right. And it takes a lot more work, because in the past, I would do it with one broad stroke and saying, okay, this is the level you must come to. Okay, it would be my level. And of course, sometimes that's a little hard. But the amazing thing was, some of them, it took years, but I would tell you 95% of them would call me in 3 to 5 years and say, Dr. Rohrich, if you didn't do that to me, I wouldn't be the plastic surgeon I'm doing today. Yeah. I bet you I had that from 100 of my trainees. Now, that was the hard work and the quote unquote spanking, but Paul is right. Today, it's a lot, we have to individualize. Everybody gets a trophy type thing, but believe me, I have 2 kids and that's how I had to raise them. But I also have to say, when I was at the University of Michigan, on those Thursday afternoons, Dr. Grab would sit in the back. It was not necessarily nice. When you said something that wasn't good, even Dr. Dingman, who was sat in the front, it was interesting. Dr. Grab sat in the back, Dr. Dingman sat in the front. And believe me, if you were trying to BS one of those guys, it didn't go over very well at all. Paul, I don't know if you remember that.
So then I have to ask both of you gentlemen, both being leading educators, do you feel like the quality of product you're turning out now that things are more gentler and fewer work hours, is the same as it was in the 90s? Because being a product of the earlier era, it was definitely miserable at times, don't get me wrong. And there were many nights of unhappiness, but I'm a better surgeon for it. And I feel really well trained for it. I think I emerged a little bit of a psychopath because of it, but I'm better for it. So the question is, do you guys, but in all honesty, because one of the things you always worry about is, are you turning out the same quality of product? What do you guys think about that?
And let me say, Samir was my chief resident, so I can attest to the psychopathology.
So he was a badass. He was a badass.
So I guess I'll go first. I don't actually think it's probably a fair comparison, because our people finishing now, they have accomplished so much more than people accomplished 15 years ago and 20 years ago. They are coming in with CVs that would make them eligible to become assistant professors on the faculty, and they're just applying for residency positions. The applicants weren't like that 15 years ago, 20 years ago. And the drive of our people, we have people finishing who published 50 manuscripts, and I mean, just outrageous levels of accomplishments. And our training is so good now that they're actually getting, 6 years of clinical plastic surgery training. They're hardly spending time doing other things. And so they're so good. So I got to tell you, I think the product we're putting out is amazing.
Really?
People are so good. And they're just using fellowship years to just fine tune things because they've had great experiences. So I'm incredibly optimistic about where we are.
That's wonderful.
Yeah, I would agree. I think the quality of the plastic surgery applicant, it's the most sought after residencies, that in dermatology, and I think the quality of that is amazing. But it also attracts, a different type of individual. Some of them necessarily shouldn't be in plastic surgery either, but hopefully we weed those out. But it is just a different time. I mean, it's like Paul said, we have to tailor the learning toward what that applicant needs, whether it's visual, whether it's other learning. It's so much different. The other thing is, we so much more directly interact and teach them one-on-one. I mean, I don't know, when I was at Michigan and even when I was at Harvard, I mean, I rarely saw a faculty member. If it was like something bad happened. That's why it was always surprising when I saw Dr. Dingman, pop up behind me at 8 at night at Children's. But so it's a different mentoring. It's much more one-on-one, and I think that's what this modern group of people need and want. But the product, I think, like Paul said, is it's better. I think that if I'd have had the same training that I give my residents today, I wouldn't have needed 30 years to become a rhinoplasty expert. And I mean, I mean it, because, I would be doing rhinoplasties at the prison at Jackson, and then Dr. Grab would say, why did you do that? I did open rhinoplasties, an African American patient. I said, well, Dr. Dingman, I said, Dr. Grab, you were my staff. Oh, okay. So, of course, he never was out there, but these are the things that, I think we do them better today, to be honest with you.
Where do you see plastic surgery being, say, then in the future? It looks bright. I have a very optimistic view of plastic surgery in the future, but both of you have better perspectives and views and experiences about predicting what you will see.
Rod, go ahead.
I think the future is bright. I think we're going to be doing so much more online learning. I think the access through COVID has pushed education forward 5 years, because now, look at what we did. I did grand rounds at 12 or 13 different universities in 6 weeks. And I was on the University of Michigan grand rounds of M&Ms multiple times. And I think that's phenomenal. So teaching is better. I think the one-on-one, I think the ability to learn plastic surgery without actually doing surgery, that ability is going to be so much better. Suturing, we're really learning how to do it with microsurgery without going to the operating room. I think so much of that is going to be automated online. And you know what? We are raising, our generation that did all of the things like Fortnite. They're very computer savvy. When you look at your kids, they do this automatically. Why do you think endoscopic surgery is so popular? Because this is kids now that are surgeons. Don't you think, Paul? They get it.
Yeah. And I would say, I think our training is getting better and better and better. And I think we have lots of new opportunities to train people outside of that incredibly stressful environment of the operating room. And they can develop these skills before they're in this horribly stressful situation with a patient right in front of them in significant consequences. But I also think our specialty is really good. I know a lot of plastic surgeons get worried because something gets developed in plastic surgery and then other surgeons sort of take it and bring it into their scope of practice and things. There is no limit to the innovative spirit of plastic surgeons. And I am not even marginally concerned about our ability to continue to innovate and discover and just stay so far ahead of other surgeons that we will always have great things we're doing. And we are never going to be the group of surgeons that are going to listen to what other surgeons tell us and we're going to do it. We're always going to be the group of surgeons that tell everyone else how to do it.
Yeah, I'm so glad for you to say that, Paul, because so many people in plastic surgery would not agree with that, because you are a true leader. Because I have never been worried about other people learning what I do if they can do it safely and well and give good outcomes. I teach people in cosmetic medicine all the time. In the past, people say we only need to teach each other. I say we teach people, if they're doing it, to do it well, to do it safely, so they get great outcomes. And most of the time, that's plastic surgery. And I don't worry about other people learning what we do, microsurgery. If they do it well, I think hands off to that. I think it's good. I don't worry about that, because if not, you're not the leader of the pack. And the leader of the pack, we don't like the view from behind.
No.
Well, I think, gentlemen, this has been incredibly educational. For closing thoughts, if you were to give one bit of advice to a plastic surgeon just embarking on their career now, the most important thing they can do to have a successful career, not just financially, but more importantly, from an intellectual and an enjoyment standpoint, what would be that advice? Either one of you guys can go first.
Paul, you go first.
Oh, thanks, Rod. I think the most important thing of all is to do that thing that you are most passionate about, whatever that is. It isn't what everyone else thinks you ought to do. It isn't what is going to be most financially beneficial to you. It should be that thing that you are most passionate about. If you're most passionate about that thing, you will read about it, you will study it, you will work hard to be the best you can possibly be at it. And then people will come from everywhere to you to have that done, and you can live your dream every single day. I got to tell you, there's so many people locked into jobs that they're doing because they could make a good living, or somebody told them they thought they ought to do that or whatever. And every day is a struggle. But I got to tell you, I would do my job for free. I mean, it is an amazing job. I love it. And I got to tell you, do that thing you're passionate about.
You know, Paul, you must have been listening to me early on, but I can tell you, you are so right. Every day I wake up and I say, thank God for plastic surgery. And of course, that's, you know, one of my insignias, because it's all about passion, focus, and doing the right thing and giving back. If you have those four things, you have mastered life, because, you know, this is not a dress rehearsal. You only live once. And I can tell you, if you have those things, you will rock the world. And that's a great thing about plastic surgery. It's the secret of life. And no matter what you do, but plastic surgery gives you all of those.
You know, it's always wonderful to hear from people that you respect and admire, and both of you guys fall into, all three of us just feel so honored that you joined us today. I think those are amazing words of advice for anyone starting in not just plastic surgery career, but life in general. So on behalf of the other two, thank you so much for joining us today, and go Blue.
All right. Well, thanks so much. It was great. What a surprise. Good to see you all.
Take care.
Thank you.